Alright, hi guys, welcome back to my channel. For those of you that don't know me, my name's Kevin. I'm a new grad RN who recently graduated with a 4.0, and I'm here to make short bite-sized videos to help you guys understand some of the harder concepts that I came across when I was a peer tutor and TA during nursing school. And one of the most frequent questions I get asked during tutoring session and exam reviews is the blood flow throughout the heart. And I know all you guys had to take anatomy and physio through prereqs to get into nursing school, but this was one of the most common topics that easily got forgotten, right? Because it's kind of hard to remember it until you actually put it to pen and paper. So my biggest advice is once you watch this video, try to do it from memory and see if you can replicate the steps, okay? So first, we're going to explain how the blood flows from the very beginning, from the veins, and how it exits the body. Now, for the purpose of this video, I'm going to be talking about blood going step by step through each of the pathways one at a time, like as if it's one single cell. But it's important to understand that the right and left atrium are beating together, and then the right and left ventricle are beating together. So even though I'm describing it as this pathway where it's going in and out like this, it's important to know that it's more like right and left are going down together at the same time and out at the same time. But anyways, let's get started. So our story starts with the superior vena cava and the inferior vena cava. These are two parts of the biggest vein in the body, and it's bringing deoxygenated blood, right? Veins bringing deoxygenated blood back to the heart. So they stop in the right atrium, okay? We're starting on the right side. Now, next comes the first important checkpoint in the anatomy of the heart. It comes across this valve, right? Now, what is the name of this valve? I'll give you guys a little way to remember it. We want to try something before we buy something, right? So this valve right here is the tricuspid valve, okay? So it goes from the veins into the right atrium, past the tricuspid valve into the right ventricle. That's pretty easy, right? Then it goes to this second valve right here. And some people are like, wait, what is this valve called? Now, I got the secret for you, okay? Look where this blood is going to. It's going to the pulmonary artery. It's going to the lungs, right? You're bringing deoxygenated blood to the lungs so they can do gas exchange out on the side and bring oxygenated blood back into our system, right? So pulmonary is another way of calling something, or another way of saying our lungs, right? So where are you going? It's like a checkpoint to another country. The blood is like the family going on a cross-country trip, right? You're going through what border here to go to what? Pulmonary. So this is the pulmonary valve, or pulmonic valve, okay? And keep in mind, this is all deoxygenated blood. Pulmonary artery is one of the only places in the body where it's deoxygenated blood inside an artery. Okay, so don't always think artery is full of oxygenated blood, because no, there's an exception. So it goes to the lungs and does gas exchange, all that good stuff, and then it comes back through the pulmonary vein with oxygenated blood, right? So once again, pulmonary vein is the only vein here that has oxygenated blood, right? So it comes in here, it goes to the left atrium, right? That's pretty simple here. Left atrium, there's another valve after the left atrium. So what is this valve called? Well, remember when I said that we try it before we buy it? That's right, this is the bicuspid valve. But it's also known as the mitral valve, okay? You may just need to memorize that bicuspid and mitral are the same thing, but most people often refer to it as mitral. Once it goes between left atrium and the mitral valve, it goes to the left ventricle, which is pretty obvious. It's pretty obvious to know that it goes from atrium to ventricle, right? It's going to the aorta. But it comes across one more valve. And this is the last checkpoint. Where is it going? The aorta. So this is the aortic valve, okay? So, and from the aorta, it goes to the rest of the body. But so from the very beginning, it goes through the veins, goes to the right atrium, goes to the tricuspid valve, to the right ventricle, the pulmonary valve or the pulmonic valve, into the pulmonary artery. All this while it's deoxygenated blood. It goes to gas exchange in the lungs, bringing oxygenated blood back to the left atrium, through the mitral valve, also known as the bicuspid valve, into the left ventricle, out into the aortic valve, into the aorta, okay? So if you just kind of think about what's the blood's next destination, it becomes very clear, okay? Especially for the semilunar valves right here, the aortic and pulmonic valves, okay? And this pair, the tricuspid and mitral valve, are also known as the AV valves, okay? Because they're separating the atrium and ventricle. So hopefully this short video helps you guys understand how the blood flows. So you guys should just, if you guys have problems with this, you guys should just write out the blood flow and do it like as if it was a singular cell. So go like right atrium to right ventricle to the lungs, left atrium, left ventricle, and then aorta. And keep in mind that in reality, it's actually both the atriums pumping blood at the same time down, right? So hopefully this helps. Let me know if there's any other confusing topics or if you guys have anything else you want me to cover. Good luck studying.